and you have described all the 4 points. Back depression inventory is a self-report rating inventory. Major attitude and symptoms of depression. That's 1 point. Has 21 items. That's second point. Close-ended nature. That's third point. Uh, four options, 0 to 3, and she has given those options. That's the 4 point. Fourth point. So all four criteria are met. Two strengths, two weaknesses. All right. One of those strengths for BDI is that it's a great tool for diagnosing depression. Therapists can easily collect the scores after BDI is taken. All right. So if she would have written that BDI is a great tool for diagnosing depression, that would not have been considered valid, because so because that's obvious, right? You did not put any input in that, but because she has elaborated that therapists can collect and compare the score of before and after, so that's how they can like correctly assess the symptoms of depression. So that guarantees her all 3 points for the first strength. Second strength, that is very easy to understand, as it is familiar, standardized test format. Participants can easily understand the guidelines for taking it in order and solve. All right, so basically this point is a bit vague, that how is BDI having easy vocabulary is an advantage. See, always ask yourself that if BDI has easy vocabulary and it is easy to understand and it's easy standardized, so what? So what? If participant did not understand, so what will happen? So because BDI is easy to understand, people will solve it knowing what each question means, and hence their answers are gonna be more valid. So the point that you were reaching for is people, because they can understand it easier, their point is gonna be more valid. So this is 1 out of 3. So the second strength will get you 1 mark. All right. Weaknesses. Again, self-report lacks the validity because people may exaggerate or downplay their symptoms. So demonic characteristics are there. That makes sense. All 3 points are secured in that first weakness. The BDI can find a person's depression level, but it fails to recognize the cause behind depression. Again, makes sense. Guarantees all 3 marks. So Ramla, you lost 2 marks in the second strength because, again, you need to elaborate a bit more on that. But otherwise, good job. Moving on to another. Well, all right. Again, 4 features that you need to write. Back depression inventory has 21 items. They're close-ended and 0 to 3, and you have given the item examples of those questions. So these are all 4 marks guaranteed. Moving on to strength and weaknesses. Two strength, two weaknesses. All right. BSDR has been widely used as an evaluation instrument to assess the severity in depression. All right. Number of studies have been carried out that show that BDI has a high level of validity, meaning that it's fairly precise in measuring the intensity of a patient's symptoms. All right, number one, when you say number of studies, you do not quote any studies. So again, when you say number of studies, I want a reference here. You did not give any reference, so like an examiner cannot be sure whether you're making your answers up or whether you have provided your answer on fact. So like the examiner cannot assess this answer, so he won't consider this answer unless and until you give a reference. Number two, what type of validity are you talking about? Concurrent validity or what type of validity? If you're talking about any type of validity, especially concurrent validity, you're supposed to write the score for that. Uh, Otherwise, give a reference for the study from that you have quoted that from. Uh, so like this point is like a bit incomplete, so you're gonna get 1 mark for that. It is easy to make statistical evaluation as provides the psychologist with quantitative data. Uh, Statistic evaluation provides the psychologist with quantitative data. All right, so this point is completely clear because again, there's nothing elaborate on this statistic evaluation, quantitative data. So that's 3 marks. Although media gives you a clear idea about severity of the symptoms, it does not provide the causes behind it and detailed picture about people. So that is a weakness that you have perfectly elaborated. So again, that guarantees you 3 marks in the first weakness. All right. Secondly, where is it? All right. All right. As it is repeating, there is a chance that like the patient may not answer honestly. So there's demand characteristics also involved as well. So same point as Ramlas. So you get 3 marks for that as well. So again, you lost marks in that first strength that you did not get the reference for regarding the validity. Otherwise, good job in your first attempt. Now we're gonna move on to our lecture for depression. Does anyone have questions on the criteria of how I evaluate it or like assess these answers? They can ask right now. As in where did they lose marks? How can they improve it? What should they do? If all points are clear, I will move on. I'm gonna give you like what 10 seconds to come up with a question if you have. For students who have missed the first lecture, I think the first previous lectures are gonna be uploaded on the drive. So like you don't need to worry about that. All clear. All right. All right, so recapping, every single disorder in your syllabus has been divided into kind of like 3 parts. First part is the symptoms, as in how to diagnose someone with that disorder and what tests do you use. Second part is gonna be causes, the reasons behind people being depressed, and third is treatment. We're done with this. Now we're gonna come towards causes and treatment. And before coming on to causes and treatment, there is something that you need to understand of how to study or as in how to look at causes according to CIE. So CIE is gonna ask you very specific questions about causes and treatments. And to do that, I'm gonna show you a past paper for that. So if you go to any past paper, especially paper 3, so whenever we talk about causes, treatments, whatever, etc., we're gonna always go towards paper 3. Like that in the previous lecture, how I told you that what is part 1B and 1C. 1B is if it's about if 1B is about something, 1C is gonna be about the same area. For example, 1B is about grant, 1C is about grant as well. So see, for abnormal psychology, apart from question 1, we're gonna look at question 2 now. And apart from this variant, because this is a new variant, so and this is the first time 2020 was the first time where they asked about the symptoms of depression and that about anxiety and test of anxiety in depth. Otherwise they ask it over here, never in question 2A. This was the first time they've done it, but otherwise what you normally encounter is in question 2A for your abnormal psychology is basically causes and treatments. So in paper 3, question 2A, over here, they're going to ask you the causes of impulse control disorder. It could have been easily causes of depression because we're talking about depression. So I'm going to mention depression a lot. Question 2A is always going to be the describe question. Describe. Question 2B is always going to be the evaluate question. Describe and evaluate. Describe means give me a summary of the things. Evaluate, I'm going to tell you what it means. But whenever you see the word describe, see, describe, it means summarize. Give me a summary of whatever is written here. Give me a summary of whatever is written here. So what happens in your paper 3 is in depression, you have 3 causes. And 3 causes or three theories or experiments or reasons why depression happens. All right. So in CIE, what's going to happen? They're going to ask you the summary for only one cause, or they're going to ask you summary for all 3 causes together. If they ask you the summary for only one cause, they're gonna specifically state, uh, describe the cause for depression according to XYZ person. The name of the theorist is going to be here. But if they're going to ask you to summarize all 3 causes, they're not going to mention a single name of the theorist. You're supposed to remember what all 3 causes of depression are. If you forget one of the three causes, you're gone. You're not going to be able to answer the question. So you need to have good memory for paper three. All right. So again, so how to study causes? Number one, you're supposed to make key points, key notes, underline, make notes, make pointers, so that you can easily make summaries of the theories that you're going to study of why depression happens. So if you are able to easily make summaries, that's question 2A done. What about 2B? Evaluate. If they're going to ask you the summary of causes for depression in 2A, 2B, they're going to ask you to evaluate whatever you've written above, as in evaluate the causes for depression. So in evaluation, how do you do this evaluation question? How do you do the 2B part? Well, in A2 psychology, what's going to happen is that there are certain evaluation points that you need to be familiar in order to progress in cause and explanations. You have heard about nature versus nurture in your AS. You have heard about individual versus situational in your AS, but you have not heard about other points that are going to follow. So before I begin teaching you cause and explanation, I need to be sure whether do you guys know what these two mean. 100%. There's no doubt about it. Are you guys clear what these two mean?
Could you explain the individual and situational one once, please?
All right. Is there any other question apart from that? Or is this the only question I'm going to get? 10 seconds, I'm going to wait. 5, 4, 3, 2, 1, and 0. All right. So this is the only question I'm going to get. Individual situational. Basically, what does this debate mean is whenever you look at causes of depression, you're supposed to ask yourself this question: what was responsible? Responsible. Is it the situation that's causing it, as in is it all environmental, or is it something about the individual that's the responsible factor? It could be a person's biology, it could be their personality, it could be their thinking process, it could be anything about that person, but it has to be something about that person. If the person is fine, if the environment is wrong, that's situational. So this is situational. But if the situation is fine, the person is, where the problem lies with, so that's individual. Is that clear? All right. Is nature and nurture clear to everyone, or do I need to explain that also? You guys need to be 100% sure what these mean in order to progress in A2 psychology. All right. So these 2 points are done. These are previous points. Now we're going to talk about new points. Again, this is the evaluation points that we're going to talk for A2. New evaluation points in your A2. Yes, these are also included. These are also in your A2, but we have new ones as well. We have reductionism. We have deterministic versus. We have scientific versus non-scientific. We can also say objective versus subjective. We have culture bias. Uh, what else? Nature determines situation, individual situation. All right. Yeah. So these are gonna be for causes, right? When we come on to treatment, there are some evaluation points that are specifically designed for treatments, but for causes, these are gonna be the ones that are there. Question. Yes. Psychometric. Psychometrics is not in causes. Psychometric, I'm gonna tell you where it comes from. So there is, I'm gonna if I don't discuss psychometric today, can someone make a point to discuss remind me to discuss psychometric in the future? Like I'm gonna assign the responsibility to someone in the classroom. So psychometric is there, but not it's not gonna be discussed over here. Other question or all right. So what do these points mean? We're gonna start off with this one, and I want you to kind of like have your brains in open because this is gonna get in depth. Reductionism versus holism. See, if you remember AS psychology, we have 12 studies, right? 12 experiments, and every one of those 12 experiments were divided into four aspects. Uh, Three experiments were from cognitive psychology, three were from biological psychology, three were from social psychology, and three were from learning or behavioral based psychology. So if you see how your AS psychology was divided, it was divided according to the perspectives of psychology or school of thought of psychology or approaches of psychology. If you feel that whatever theory is only focusing on one approach, as in, let's suppose the theory of behind let's suppose the reason depression happens is because genetics is the reason why depression happens. If your genetics are fine, if your mom and dad are fine, you will not have depression. If your mom and dad are depressed, you also get depression, nothing else. We're not going to talk about breakups. We're not going to talk about social like economic status. We're not going to talk about uh, lack of self-esteem or negative thoughts. We're going to talk about genetics only. And if you feel that this is limited to one approach, does not consider all the other approaches, you're 100% correct in saying that it is reductionist. So reductionist means that you're going to consider only one approach and ignore the others. Holism is the opposite. Holism is considering more than one approach or trying to consider all the other perspective there is. So holism is kind of a mixture of everything. Reductionist is kind of like sticking to one thing and ignoring all the other approaches. Is that clear? All right. Deterministic versus free will. It's a bit tricky. See, there are certain factors that you can actively act, and I mean the word actively influence, that you can really do something about it. And there are other things that are not in your control. See, if depression happens because of genetics, you cannot do anything about genetics. It's out of your hand. If depression was because of negative thoughts, you can do something because if you go to therapy, they tell you to change your negative thoughts, and negative thoughts will not get changed if you don't want them to change. It is changed when you want them to change, right? So certain things you have active role in and certain things you don't have active role in. Deterministic means that you have no control over it or you have no active role in it. That's determinism. Free will means that it's in your control or you have active role in it. So that's free will and determinism. Genetics is going to be deterministic. Negative thoughts is going to be free will. Brain chemical imbalance is going to be deterministic. Uh, but let's suppose changing your behavior is going to be free will. Uh, let's suppose something that happened in your childhood that's influencing you now unconsciously, not in your consciously, you're not aware of it. It's happening in your unconsciousness. Is deterministic because it's not in your control. Once you get aware of it, then it's gonna be free will. So deterministic means things that you cannot do anything about it. Free will, things that you can do something about. Make sense? All right. What about everyone else? Does it make sense to other people? Right. So this is clear. Scientific versus non-scientific. See, there are certain theories of depression that may make sense to you, but cannot be scientifically proven. What do I mean by scientifically proven? It cannot be facts, as in genes can be studied under a microscope. Everyone acknowledges that genes do exist. They are physically present. You can see them, you can touch them if you are microscopic. You can study them, so these are scientific. Brain chemicals, scientific. Biological things, scientific. Thoughts, you cannot scientifically prove them because we cannot study thoughts, right? Thoughts don't exist physically. If I say depression happens because of negative thoughts, yes, it may make sense, but it's not scientific. Depression may happen because of brain chemical failure, may make sense, but it's also scientific. So things that are scientific are fact and objective. Things that are not scientific are, like, subjective. It depends on a person to person. As in, one theorist believes that negative thoughts cause depression. Other theorists believe that childhood has to do with depression. They both explain the cause of depression, but one person says something else, the other person says something else because they are subjective. Scientists believe that depression happens because of brain chemicals. If you go to a scientist, they will have only one explanation for things. If you go to psychologists, they will have multiple explanation of things because certain times theories are non-scientific in nature, they're subjective. Certain times findings are scientific in nature, they're objective, and there is no other explanation other than that. Is scientific and non-scientific clear? All right. Culture bias. See, certain times depression or any other disorder, of why does disorders happen? See, every culture believes in something. Every culture has certain elements that are unique from other cultures. We say depression can happen because someone is not close to God. May not be true in other societies. We can say that depression happens because someone is possessed by a spirit who's evil. Maybe, making sense in Latin cultures, but does not make sense in our cultures. So certain explanations are different according to every single culture. Some people say that if you cry or if you mourn for 40 days, in Muslim culture, I guess you people mourn for 40 days, like, like there's a full 40th in some houses. Some people don't light stoves in their house for 3 days. People of the Western world will say that you guys are depressed, but in this culture it's completely normal. We're not depressed, we're mourning. So things are perceived differently by other cultures. So if you feel that certain explanation for depression might not make sense in every single culture and is limited to one culture, that's culture bias. So that is culture bias. Make sense? All right. See, now when you come across causes for depression, sometimes you will have a theory and no experiment. As in, there has been no experiment conducted on it. It's just an explanation of why depression happens. Let's suppose depression happens because of negative thoughts, but there's no experiment to prove that. So some causes are only theories, and some causes are told as experiments. So you will have two type of causes. Some causes are only theoretical based, and some causes have experiments in them. Whatever points that I have stated, all of these are up over here are gonna be based on theoretical explanations or theoretical causes, not experiments. For experiments, there's something else. These are all based on theories. If you feel that this causes or this explanation of depression is theoretical, is gonna be this. But if there's an experiment involved, there are other points that you will include in your evaluation. What are these other points that can be used in experiment? The ones that you have in AS. We have this formula. Is Are you guys aware of the GRAVED? Yep. All right. No. All right. G is generalizability, or reliability is application, is validity, is ethics, data, as in quantitative or qualitative. S- Application, we're not going to consider over here. Ethics, we're not going to consider over here. You're left with GRVD. GRVD is see, when we have experiments, they're always going to be samples. So is your sample in the experiment generalizable or is not generalizable? Is your experiment reliable, not reliable, valid, not valid? And the experiment was conducted, right? It gave some sort of data. So the data that you get, is it quantitative? If it's quantitative, what's the advantage, what's the weakness? If it's qualitative, what's the advantage, what's the weakness? So if it's an experiment, you can use these points as well. So in experiments, you're going to use these 4 points. Along with, you can use these points as well. So experiments, you have 1, 2, 3, 4, and these 4 points. But in theories, for theories, you cannot use these points, because in theories you don't conduct experiments, so there's no sample, there's no procedure, there's no data. In experiments, you can use these points and these points as well. For theories, you're going to use only the points above. Make sense? How can we differentiate between them? All right, how can we differentiate between them is one question. Does anyone have other questions, or is everyone else clear? All right, so how can we differentiate between the same question from, okay, how can we differentiate between them? All right, let's suppose that in your syllabus for depression, I'm going to explain you one cause right now. All right. So, and yeah, yours this so this is like the cause of depression. One cause of your depression in your syllabus is by Aaron Beck. He says that depression happens because of negative thoughts. So you guys need to keep your mind open, because this is gonna get in depth pretty soon. See, Beck says that you kind of have a negative triad. Tri means three. So there's three negative things that you think about. You have negative thinking about the world, the future, yourself. You think negatively about the world, you think negatively about the future, and you think negatively about yourself. And these three negative thoughts form a negative triad, right? Make sense according to the name. Now, because these are all negative thoughts, right? Negative thinking about the world, the future, and the self thoughts. So these are cognitive in nature. So Beck is purely cognitive. He's not going to talk about your biology, right? He's not going to talk about your behavior. He's not going to talk about your emotions. He's going to talk about what you think when you're depressed. So according to Beck, you think negative things about the world, the self, the future, and these three things make a negative triad. Now, if the first step is clear, I'm going to move on to something else. See, if you think things repeatedly, if you repeat a thought again and again and again and again, it's gonna become a belief. Certain things you don't believe, but you think about them. But if you keep thinking about them, you start to believe them. And Beck says the same thing. If you start to repeat or think negatively repeatedly, you will hence develop a negative belief in yourself. All right, could you guys give me 15 seconds? Yeah. All right, guys, back. All right, so think of it this way. Think of it. Think of it this way. Have you ever met a person who thinks negative things, or who like goes towards the negative? If the situation is like in the middle area, it's not positive, it's not negative, it's a rainy day, right? This person would say, great, it's a rainy day, like my, things are gonna get ruined now, roads are gonna get flooded. This person is used to going towards the negative end, and according to Beck, it happens because this person keeps thinking negative things. So they have developed a negative bias by thinking negative things repeatedly. This is the first step. If this thing happens again and again, this person will develop a negative bias in themselves. They will then start to see things automatically negative. Never stay in the middle, never stay in the positive. They will start to evaluate things negatively again and again and again. Make sense? So when you do that, you start to think things differently. You start to distort things. Things may not be negative at all. Let's suppose that a person did not say hi to you, right? Person did not say hi to you. You have your best friend. You come to university, you come to college, person passed by you, did not say hi to you. The person who is used to thinking negative things will say, this person hates me. Other than thinking alternative thoughts, maybe this person did not see me, maybe this person was busy, maybe this person is going through things. No, no, no. Over here, this person hates me is gonna be their automatic belief now, because they're used to thinking things negatively. Now they believe negative things, and that's what Beck says. So according to CI syllabus, what are you supposed to remember about Beck? Summary about Beck. Beck says that according to Beck, you that have a negative triad about negative view about the world, the self, the future. And because of that, you start to develop a negative bias, due to which depression happens. Make sense? So that's Beck's summary. Now, Beck did not conduct any experiment to prove that. That's it. This is Beck's summary. According to your CIE syllabus, according to your marking scheme, there's no experiment about it. So this is purely theoretical. No experiment, only theoretical. So if we were to look at Beck, if you were to evaluate it, guys, now turn your mics on. Do you think that Beck is reductionist or holistic? Is Beck considering only one approach, one perspective, or he's like, you know,
He's considering only one.
which is what?
Like the negative thoughts are the reason why depression happens.
All right. So which approach is he sticking to only? What's the name of the
Um,
approach?
Cognition.
Cognitive. Yep, cognitive. He's only sticking to one cognitive approach. All right. Uh, free will deterministic.
can you repeat that, sir?
Free will or deterministic? Deterministic.
It's free will. You can control it.
How can you control it? Like,
Well, if the negative thoughts are happening because like it's in your head, so you know about the negative thoughts, so you can
mhm.
do something, like get treatment or go to a therapist to fix that,
All right. So
or
negative.
even
Yeah, yeah.
yeah, it's free will. You can change that yourself as well.
All right, so there are therapies that are going to work on your thoughts, so that you can change your thoughts in your therapy, and those thoughts will not change if you don't want them to change. So it is free will, it is in your control. You do have an active role in your thoughts. All right, nature nurture. Is this born or do they learn? Is there learning here?
It's more like nurture.
Because
It depends on there has to be something that causes the person to think that way. It's not I wouldn't say that it's genetic, that if your parents do that, if
mm,
your parents are thinking about something that's ridiculous, like that's negative, but I wouldn't think that you would know that by birth to think negatively about every single thing. So I think that something might have happened, or maybe it and how they were raised.
all right, you see, all right, negative bias. This thing develops. See, when you talk about nurture, right? You use the word either learns or develop.
Yeah.
Learn, learn or develops.
Mm.
Negative bias develops because the person thinks negative things repeatedly. It develops, right? So when you use the word develops, you automatically go towards nurture. So the negative bias was nurtured in that individual because of repeated negative thoughts about the world of the future.
Okay.
All right. Individual situational. Who's to
Both.
blame? Both.
Both.
How? Justify both.
Well, it could be situational as it could be situational in some situations and individual in some situations. That in some situations, if the environment they're in is negative, the person is bound to think negatively, and in some cases, a person's personality uh, makes them think that way. So that would be individual. So it depends on the situation we're talking about.
All right. The Zoom meeting is gonna end in 1 minute. I'm gonna restart the Zoom meeting. Right. I'm gonna hold you to that answer. I'm gonna ask this question to someone else if someone has a different answer. So I'm gonna
Sure.
restart the meeting right now.